right, and welcome back after lunch. Great lunch. I like to give new presentations, in part because I'd like to help advance your education, in part because it challenges me to learn new things. And so each and every advanced study weekend, I try and present new lectures, new materials. And so what I'm going to do today is I'm going to present a lecture I've never given before. Hopefully it's not obvious. And I'm going to talk to you about some very complicated things, but hopefully I can make them understandable. I hate to begin my lecture this way because it may be setting me up for failure, but I can just tell you that if somebody understands their subject, then they should be able to explain it to you. If you listen to a presenter, a speaker, and you sit there in the audience, and I've done this so many times before, you sit and you listen in the audience, and you listen to the speaker, you go, oh, they're so smart. I can't understand a thing they're saying. That's not the problem. The problem is they don't understand their subject. Because a good presenter, as we've had the speakers this weekend, a good presenter understands their subject well enough that they'll be able to explain complex issues to anybody sitting in the audience. Now, with that challenge in mind, I've got some very complicated things to talk to you about. As many of you have, I read the national best-selling book, Steve Jobs, by Walter Isaacson. I highly recommend it. It's a very enjoyable book. And what I'm going to do is I'm going to talk to you a bit about what I learned and some of the concerns I had when I read this book. Steve Jobs, didn't know him, really wasn't interested in him until I read the book. Of course, I'd heard his name, as many of you had. Didn't know about his reputation as a person or a personality. Didn't really understand all the things that he did. But since I read his biography, I've learned a lot about him and, of course, developed a whole new appreciation of the man. He lived 56 years, not long. He was born 1955, just died recently in October of 2011. For those of you who don't know, Steve Jobs has made great contributions. The thing you'll probably most recognize is the Mac computers. Well, probably even more than that, you'll recognize the iPhone. Yeah, the iPhone or the new iPads or iTunes. I'm sure the list goes on longer than that, but those are the things that Steve Jobs is most known for, is his genius in developing products that were so consumer friendly and interactive. The other thing he did that of course makes my grandchildren so happy is he was the CEO of Pixar, which was innovative in terms of animation and movie pictures. And so those are the two things that Steve Jobs was most known for. If you read his biography, you'll see that he gave me permission and actually, in a way, encouraged me to do a write-up about him and to put it in my November 2011 newsletter. He said in his biography, and the parentheses you see here with numbers in them represent the page numbers in the biography you would like to look up the statements. He said, giving me tacit permission to do what I'm doing now in the November 2011 newsletter, he said, when I got sick, I realized other people would write about me if I died, and they wouldn't know anything. They'd get it all wrong. So I wanted to make sure someone heard what I had to say. Well, what more encouragement can somebody give than that for me to take and explore what went on with Steve Jobs? I think Steve Jobs would have been very pleased with my assessment that I'm going to present for you over the next few minutes, as well as a thorough assessment I presented in the November 2011 newsletter. I mean, my thoughts were in agreement with what he intellectually and instinctively believed about medical treatments as well as good nutrition. And one of the purposes of doing this exploration, my perspective on what happened with Steve Jobs and why he died, one of the reasons that I took it on with such passion, and this is probably the most difficult and yet the most exciting article that I've ever written, is because I wanted to set the record straight for you, for his friends, and most importantly for his family. The way this all started out, as I mentioned to you a couple of days ago, is Mary and I were in a Verizon store in Portland, Oregon, and a young man picked up a mobile phone and asked Siri, why did Steve Jobs die? And I was reading the biography, and I thought, well, I've learned enough things in this biography that make me want to answer that question too, and share that answer with you. The other thing that stimulated me so much to do this writing and to give this presentation is because of a 60 Minutes report that I heard at the same time. All these things coincidentally happened at the same time. And that 60 Minutes report said the following things. In that report, you'll find statements that gave you the impression that Steve Jobs could have been cured of his cancer, a pancreatic cancer. Try and remember these points. He was foolish to pursue a diet as the answer to his cancer. By delaying surgery, he killed himself. And what a thing to live with. Steve Jobs was referred to as stupid in this 60 Minutes report. And in the report, it says everyone, everyone, you, his friends, his relatives, his wife, everyone thought they had the right answer concerning not only his surgery and what he should have done, but also what he should eat and not eat. In this report by 60 Minutes, you'll see Jobs referred to as having delusional thinking. In other words, he had an imagination that put him in places that none of us could go, but that was part of his genius. And that Jobs lived, they will tell you in the 60 Minutes interview, Jobs lived with regret the remainder of his life. For 8 years, he lived believing that he'd done foolish things in terms of his surgery and his diet that resulted in an earlier death and a more miserable life.
And then they do a biopsy, and they're very emotional. They say, this is good. It's one of these very slow-growing 5% of pancreatic cancers that can actually be cured. But Steve Jobs doesn't get operated on right away. He tries to treat it with diet. He goes to spiritualists. He goes to various ways of doing it macrobiotically, and he doesn't get an operation.
Why doesn't he get it operated on immediately?
You know, I've asked him that. He said, I didn't want my body to be opened. I didn't want to be violated in that way. He's regretful about it. And his wife, who's a very solid, decent person, understood it, but said, no, no, the body is there to serve the spirit. You should get this operated. And soon everybody is telling him, quit trying to treat it with all these roots and vegetables and things. Just get operated on. But he does it 9 months later.
Too late.
Well, one assumes it's too late because by the time they operate on him, they notice that it has spread to the tissues around the pancreas.
How could such a smart man do such a stupid thing?
Yeah, I think that he kind of felt that if you ignore something, if you don't want something to exist, you can have magical thinking. And it had worked for him in the past. He regretted it.
So let's explore this. First thing I'd like to share with you is my understanding that says that Steve Jobs' cancer began and metastasized, in other words, spread to the rest of the body, not 9 months before he was operated on, but when he was a young man, maybe as young as when he was a teenager. His initial diagnosis, in October of 2003, he happened to run into his urologist who had treated him, and she asked him to get a CAT scan of his kidneys and ureter. It had been 5 years since the last scan. The new scan revealed nothing wrong with his kidneys. Please note that, nothing wrong with his kidneys. But it did show a shadow on his pancreas. And subsequent to that finding, they did a needle biopsy by sticking a tube down into his throat and then into that tumor area that they saw on the CAT scan, took out some cells and made the diagnosis of pancreatic cancer, islet cell pancreatic cancer, non-endocrine cancer, pancreatic cancer. I want you to note, here's where the pancreas lies in the abdomen. And you see it's right there in the central abdomen. It lies right next to the kidney. And here again, you see the kidney and you see the pancreas lying right next to it. You can see how close the organs are together and how kidney problems and pancreatic problems could so easily be confused. Here is the pancreas in relation to the bowel. You've got the gallbladder and you've got the pancreas. The liver sits right up in here, the stomach, and the rest of the small intestine. So here's your pancreas right in the abdomen. Here's the tumor that was found. I don't know what size it was. It was just reported as being found on a CAT scan. The smallest tumor you can find on a CAT scan is about 2 centimeters in size, which is about twice the size of a BB. About half the size, would be about twice the size of a period on a paper. Just very tiny, but that would be hard to see even with a CAT scan. If you saw a tumor on a CAT scan of the pancreas, you generally expect it to be about 1 centimeter in size, which is about 1/2 inch. And likely it was even bigger than that. I don't know, I don't have his medical records, but I think it's fair to assume the tumor that they found on this CAT scan, on this x-ray, was at least 1/2 inch in size. Well, we know that when people have cancer, this is all kinds of cancers, lung cancer, pancreatic cancer, breast cancer, colon cancer, etc., that people die when their individual tumors get to about 10 centimeters or about 4 inches in diameter. So when you get to that tumor mass in the body, that's the end of life. Now, the way you get from the first cancer cell, and always one cancer cell leads the way. What happens is things from the environment, like environmental chemicals or the foods we eat or cigarette smoke, things from the environment attack our cells. And when they attack the cells very badly, they usually kill the cells. But sometimes they attack the cells badly enough not to kill them, but badly enough to cause them to start dividing at their own free will. And that's one of the initial steps and characteristics of cancer. Cells in general have to live in a very neighborly manner. One cell that lives next to the other can't divide its own free will. If it did, if cells divided at their own free will, you'd be a misshapen mass in a matter of a few hours. Instead, cells have rules, and one of those rules is you don't divide. Well, there are a couple of exceptions, like if you're a child growing, you get signals from your brain that says, okay, you can divide, you can grow into a bigger person. Or if, say, you damage yourself, say you cut your skin, then the cells next to that wound can divide. It's part of the rules, part of the survival mechanisms of the body. They can divide and repair that wound. Otherwise, cells aren't allowed to divide. But what happens in cancer, be it in the breast or the colon or the prostate or the pancreas, is cells get injured and they stop being neighborly and they start dividing at their own free will. And so here you have the first cell, and let's just go to Jobs' pancreatic cancer, the first cell that becomes cancerous. And it starts dividing at its free will. It turns into 2 cells. And there's a time interval here. It's called the doubling time, how much time it takes to go from 1 cell to 2 cells, and then 2 cells to 4, and then 4 to 8, and 16, and 32, and so on, until you develop a large tumor mass. When a tumor mass is 1 millimeter in size, it contains 1 million cells. When it's 1 centimeter in size, which is 1/2 inch, that tumor mass is 1 billion cells. All right, so what we know is at age 48, when he had that CAT scan and the subsequent needle biopsy of the pancreas, which diagnosed him as having islet cell cancer, or non-endocrine cell cancer of the pancreas, he was 48 years old, and I think it's fair to assume that the tumor that they saw on that CAT scan was 1 centimeter in size. I'm being generous. It could have been a little bigger than that, but it was probably 1 centimeter in size. He was 48 years old, and he died at age 56, and we know the tumor mass, because that's how big it gets when people die. The tumor mass was now about 10 centimeters. The interval in time here between 48 and 56 is 8 years. So it took 8 years to double from 1 billion cells into a tumor mass that was big enough to kill him. 8 years. So what we need to find out is what the doubling intervals would be for a mass to grow from 1 centimeter to 10 centimeters. How fast would it have to double to make this kind of change in 8 years? And the way we figure this out is by very complicated mathematics, but they can be found, these mathematics, on a website where you just enter. You enter the time the tumor starts, the time the patient died, and what it does is it tells you how fast the tumor is doubling. And based on these kinds of calculations that any of you can do, if you go to the November 2011 newsletter, it'll show you where the site is, it'll show you where the numbers are that you enter, and what you figure out is that Steve Jobs' tumor doubled about every 10 months. So to go from 1 centimeter to 10 centimeters during an 8-year period of time, those tumors had to double every 10 months. Okay, with me? All right, so we know that. His tumor was actually a very slow-growing tumor. The average doubling times of tumors, say of the lung, of the breast, the colon, or the pancreas, the average doubling times are about every 3 to 9 months. His was every 10 months, so it was slow doubling. All right, so we went from 1 centimeter to 10 centimeter with a doubling time of 10 months. Every 10 months it doubled. Took an 8-year period of time. From that, we can figure out when the cancer started. When that first cell that became cancerous, when was that? All right, so you've got the doubling time from 1 centimeter, that's what we found in the pancreas, to a tumor mass of 10 centimeters, which is how big the tumors are by the time a person dies. That took place in 8 years, means those doublings took place in every 10 months. All right, well, let's just go backwards. Let's go from 1 centimeter to the first cell at a doubling rate of every 10 months. So we can calculate how far back it was that that first cell became cancerous in the pancreas. All right? So we put our calculations back into this double time calculator. And what we find is that to go from 1 centimeter to the first cell took 24 years. That means that Steve Jobs developed cancer of the pancreas when he was 24 years old. Okay? It's just simple math. And then it took him another 8 years before that tumor mass they found in the pancreas finally got big enough to kill him. All right. The surgery was finally performed. Steve Jobs, even after he had a diagnosis, he had the needle biopsy, he knew he was sick, he had significant problems, and encouragement from his wife, his friends, his family, his surgeons, everybody encouraged him to have surgery. And he said, no, I'm not going to do it. I don't want my body violated. I don't want to be opened up. And he was a great believer in the body's ability to heal itself. He'd been a vegetarian, a vegan for a long time. We're going to talk about that. So he, plain and simple, which I'm sure many of you think was foolish, or maybe you would have before you met me, think it's foolish. He said, I'm not going to have surgery. And he delayed surgery for 9 months until he got some repeat CAT scans and found things were obviously growing, and whatever efforts he was making wasn't making a difference. And then finally, on July 31st of 2004, he submitted to major abdominal surgery, and they opened him up. They opened him up, and what they found when they operated on him is not only did they find the tumor in the head of the pancreas, but they also found metastases on the liver. These are little tumors on the liver which result from the cancer of the pancreas spreading to the liver cells. And that was present July 31st, 2004, when he was operated on, 9 months after the initial diagnosis. What they did for surgery is they did something called a modified Whipple procedure. Whipple, I mean, this procedure was first done in 1898. Okay? I mean, this is 2004. That's modern technology. It's a procedure that was done, more than 100 years ago. And the version of Whipple that we use these days was originally done in 1935. What they essentially did is they took the head of his pancreas out. They took part of his small intestine. His gallbladder was removed. Then what they do is they attach this distal part of the small intestine to the stomach. In other words, this major surgery that they do, this is a really big deal, a modified Whipple procedure, with the thought that it might have cured him if the cancer was isolated to the pancreas. But when they did the surgery, what they found is they found little bits of tumor, little tumors growing. I don't know how big they are. I don't have his operative report. I have to make some assumptions. But they found tumors in the liver. Now, of course, these are big, big metastases. But my guess is he had metastases at least of this size, maybe this size. Let's just guess they were a centimeter in size. I think that's a fair estimate. So when they operated on July 31st, 2004, took out the pancreas, took some of the intestine, took the gallbladder out, it was already obvious that he had spread cancer not only to the liver, but to the rest of the body. It spreads every place when you see it in the liver. All right, so here we have the cancer in the pancreas that Jobs had diagnosed in October of 2003, which was finally operated on in July of 2004. And what happened was the tumor had spread through the bloodstream to other parts of the body. Here's what happens. Here you have the pancreatic tumor. That's the cancer in the pancreas. What happens is the little cancer cells, they break through into the venous blood system, into the veins, not into the lymph nodes. Yeah, it goes into the lymph system, but the major mechanism of spread is it goes into the veins, and then it will lodge in the liver or the bones or the brain or other parts of the body, and it starts growing at a similar doubling rate, similar doubling time. Remember, the doubling time that I calculated for the original tumor is every 10 months. And the doubling time of the metastases should be similar. All right, so follow with me. They operated on him. They did the surgery, and that was July 31st of 2004. And they found these metastases on his liver, and we're going to guess they were a ½ an inch in size because they'd be easy to see. All right, they're ½ an inch in size. And then he lived from July 31st, 2004, he lived until October of 2011. So he lived for 7 years. So we know how long he lived. We know the tumor had to double at a certain rate to get from that size to a tumor mass where he would die. So that time was 7 years. So what we do is we go back to our doubling time calculator, we enter the numbers, and what we find is the doubling time for that metastatic tumor is about every 8 months. Should have been 10. 8 months is close enough. Doubled every 8 months. All right, so here we go. We've got the cancer in the liver, the metastatic cancer in the liver. Here's when he dies, when the tumor mass gets this size. We know it took 7 years. We know the doubling time every 8 months, maybe every 10 months, the tumor doubled. I'm giving some real advantages here. It could have been, like I say, it could have been a lot earlier than I said. It wouldn't have been later. All right, so you have the tumor mass. You know how long it took to go from here to here. So you just take that doubling time and you calculate back to when the first cell spread from the pancreas to the liver based on that doubling time, and fill in your calculations, and what you find is that based on that doubling time of 8 months, he was 27 years old. If you made the doubling time 10 months, he'd been even younger. You with me? All right. So he was 27 years old when the cancer spread from his pancreas to his liver. He was 24 years old, age 48 when they first found it on CAT scan. Surgery performed at age 49. He had metastases to the liver. If you do the doubling time calculations, you find out the cancer started at age 24, and you found it spread around age 27. All right. Getting back to the point that Steve Jobs was told by everybody, his wife, his friends, his family, all of his physicians, that he was a fool to have delayed surgery for 9 months. Because in that 9-month interval, what happened is the cancer, which was confined to the pancreas, spread to the rest of the body during those 9 months. Could not have happened. No one who knows anything about this disease would ever come to that conclusion. And I just showed you how long it really took and how early he actually had the cancer. All right. So we knew Steve Jobs. There's some indications Steve Jobs had problems early in life besides just the mathematics I showed you. In a report about Jobs' mannerisms during a meeting, it was described his hands, which are slightly inexplicably yellow, are in constant motion. Yellow skin is characteristically due to jaundice. Jaundice is characteristically due to obstruction of the bile duct. One of the most common reasons for obstruction of the bile duct, and I've seen this in all too many patients, is cancer of the pancreas. 1987. He was described as having abdominal and back pains 5 years before that CAT scan in October of 2003. And he was told that those abdominal and back pains were due to kidney problems. And Steve Jobs believed that he was having back pains and abdominal pains due to kidney problems. He says, I was driving up to Pixar and down to Apple in my black Porsche convertible, and I started to get kidney stones. I'd rush to the hospital. Sounds like this happened many times. I rushed to the hospital, and the hospital would give me a shot of Demerol in the butt, and eventually I'd pass it. I don't believe what he had was kidney stones. I believe what he had was he had symptoms from his pancreatic cancer. Why do I believe that? Well, in the CAT scan, remember, in that CAT scan where they made the diagnosis, they said there was nothing wrong with his kidneys. I think the doctors misdiagnosed him. I think he was suffering from pain from that pancreatic tumor, not kidney stones. So you can see how that could easily happen. Here are the kidneys, here's the pancreas. All right, troubles. The other reason I don't believe that he had kidney stones is because kidney stones are due to eating a high animal protein diet. What happens when you eat animal proteins, you're eating a very acidic diet, which we talked about. When you eat all that acid, what happens is you dissolve the bones. We talked about this on Friday night. You dissolve the bones, that bone material is excreted into your urinary tract, and in the process, the materials, they solidify and they form calcium stones. Almost all calcium stones, almost all kidney stones we find in our society are calcium-based. He was a vegan. There was an article published in 1978 in the British Journal of Urology, which was titled, "Should Recurrent Stone Formers Become Vegetarians?" We knew this in 1978, that the reason you get these kidney stones is this high animal protein diet, which dissolves the bones, and those bones re-solidify in the kidneys. How in there could this man who has been a vegan his whole life have developed kidney stones? I don't believe it. I believe it's due to his pancreatic cancer. Other indications that he may have had this cancer earlier in life come from the book, the biography. In 1983, Jobs confided in John Sculley, who was the CEO of Apple at that time. He said, "I believe I will die young." He was 28 years old at that time. I told you that the cancer likely started when he was 24 and it metastasized by 27. By 28, he already had doom and gloom about his life. Maybe because he was so intuitive, maybe he had some insight into the fact that there really was something wrong even way back then. All right, so Jobs believed he'd killed himself. Can you imagine living with that? Can you imagine, I mean, your life is difficult already. You got pancreatic cancer, you're involved in the medical business, and you believed that you did it to yourself. You could have been saved if you could have had your surgery 9 months earlier. 8 years of regret, guilt, and remorse. And that could have been solved by any of his doctors. The doctor who originally did the diagnosis in 2003, the doctor who did the liver transplant in 2009, any of those doctors know exactly what I'm telling you now. And they could have said to Steve Jobs, just to give him peace of mind, still let him suffer for 8 years, they could have said, "Mr. Jobs, you had a body full of cancer long before you were diagnosed in October of 2003. There's no reason for you to feel guilty." But not a one of them said that to him. All right, his final events. Beginning in 2008, it was clear that Jobs and his doctor, this cancer had spread. Still, they didn't tell him. They didn't tell him that this began decades before. In April 2009, he went under a liver transplant, and when his doctors took out his liver, they found spots on the peritoneum, that's the lining. It was every place. The thin membrane that surrounds the organ. In addition, there were tumors throughout his liver, which meant he would likely had cancer everywhere. Of course, he had cancer everywhere. By July of 2011, his cancer had spread to his bones and other parts of his body, and everybody agreed there was no hope. And then he died October 5th, 2011. But the consensus was, and is today, except for people who have gone through the analysis that I've gone through, nobody's made a criticism of what I've done. It's been out since November of 2011. It's very well read. The overall consensus was and still is that Jobs acted selfishly, stupidly, and irresponsibly by not having his surgery done. It's impossible for that to have been the case, based upon standard natural history and understanding of how cancer grows and spreads. All right, remember, just to recap for you, cancer was first seen on the CAT scan October of 2003 at age 48. Delayed surgery for 9 months. He had definitive surgery at age 49. That interval, I don't know how anybody could come to that conclusion, was thought to be a reckless decision to delay, but in truth, based upon the calculations, his cancer began at age 24 and it spread by age 27. All right, how did Jobs get cancer as a teenager or a young adult in his 20s? Well, Jobs worked in Silicon Valley in the computer industry. Summer of his freshman year out of high school in Los Altos, California, Jobs called Bill Hewlett of Hewlett Packard. And on the phone, he talked to him, he said, and Packard, he said, and he answered and chatted with me for about 20 minutes. He got me the parts, but he also got me a job in a plant where they made frequency counters. He started working in the computer industry when he was 14, 15 years old. It was exposed to all kinds of carcinogens. The regulation in Silicon Valley in the electronics industry is, even today, it's, well, it's better today, but back then it was almost no regulation at all. I mean, people didn't even think about these things that they were working with in electronics to be in any way toxic. Yet these days, and to some extent back then, we knew that these chemicals that they were working with, the organic and the inorganic materials, initiated and also caused the progression of cancer. Cadmium and lead, for example. We know from scientific research, articles have been published, that lead will cause islet cell, non-endocrine pancreatic cancer, just like Jobs had. There's discussions in his book, this biography, that talk about Jobs soldering computers together, and solder is made of lead. And I can imagine from my few experiences of soldering that he inhaled that without any concern at all. All kinds of metals are found in personal computers, aluminum and arsenic and cadmium and cobalt, all kinds of toxic cancer-causing chemicals. I believe that Steve Jobs was exposed to cancer-causing chemicals as a teenager and a young adult. I know he was. It's not a belief. Everybody knows this. And as a result of that kind of exposure, he had injury to his cells. One cell led the way. That's a cell in the pancreas. That's when he started cancer. He was about 24 years old, maybe younger. And that cancer, as you would expect, went through the veins, spread to the rest of his body by the time he was 27. Let's get to another issue of Jobs. Throughout his whole life, Jobs ate a healthy diet, and he was described as an extremely healthy person. Throughout his life, he was considered prickly, whip-thin vegetarian. That's a quote from the book. He was described as looking rather like a boxer, aggressive, elusive, graceful, and like an elegant jungle cat ready to spring at its prey. Anybody that ever saw Jobs, any pictures you ever saw of Jobs, anybody who knew Jobs, always marveled at his excellent health. I wonder if they thought about that being related to his vegetarian diet. Well, when he got sick and died, there was a whole other story told. Thanks to his co-founder at Apple, Steve Wozniak. Steve Wozniak, every picture I've been seeing, he's very overweight or obese. Yet, and this was fodder for people who like to hear good news about their bad habits, yet Steve Jobs, who's obviously Wozniak, who's obviously overweight, was 4 years older than Jobs, and still alive, ate at Denny's, and his favorite foods were pizzas and burgers. So what did the public say when Steve Jobs died of pancreatic cancer? See, it doesn't matter what you eat. In fact, if you're a vegetarian, you're likely to get pancreatic cancer and die. Yeah, that was the response. And don't kid yourself. I'm sure you heard that, particularly if you eat a healthy diet yourself. I'm sure one of your friends or relatives came up to you and said, see, doesn't do you any good to eat a healthy diet. Look what happened to Steve Jobs. That's a paradox, apparent paradox. But you know what happened to Steve Jobs was just like getting struck by lightning, or walking out in the street and get hit by a car. He happened to get exposed to these very toxic metals, and because of bad luck, the wrath of God, genetics, or whatever you want to say, in his case, those toxic metals or organic materials that are poisonous caused his pancreatic cells to become deranged, and thus the cancer started. Just bad luck. Steve Jobs was a vegetarian most of his life. Became a vegetarian at Reed College in Portland, Oregon when he was a freshman in college, so he was by 18 years old. And he was a very strict vegetarian. Don't kid yourself. There are only a few lapses in his vegetarian diet throughout his life. When a waiter at a restaurant served him a sauce with sour cream, Jobs got nasty. And he was observed to spit out a mouthful of soup one day after he learned that it contained butter. But I think Jobs could have been a better vegetarian. I'm concerned about some of the things he ate, even though I do believe that his healthy diet prolonged his life and was a major factor in the fact that his cancer was so slow growing. Remember, he lived 30 years with pancreatic cancer. But he could have done better. His diet was high in vegetable oils, I would guess. Why do I guess that? Well, most vegetarians, even vegans, eat a high oil diet, and oil is cancer promoting. And he ate all the time. Reading his biography, you see he ate out all the time. And likely he ate lots of fake meats and fake cheeses as a vegan. Very common practice. There's every reason to believe this, particularly when I hear about the restaurants he went to. And these isolated soy proteins, they're cancer promoting because they raise growth factors, as you heard about this weekend. Growth factors stimulate cancer growth. And so he could have eaten a better diet. But I think his vegan diet actually helped him. Now let me tell you about the ultimate insult to Jobs. Here he is, diagnosed in October 2004, goes through major surgery, has his head of his pancreas removed, his gallbladder removed, his bile ducts removed, some of his intestine removed, goes through this Whipple procedure, causes him terrible malabsorption. as a consequence of this major surgery, the narcotics he had to take, the pain he was in, and so on, he lost weight. He lost 40 and then 50 pounds he lost. And as they say in the book, one of the side effects of the operation would become a problem for Jobs because of his obsessive diet. Listen to this. They said the reason he lost the weight, the 40 to 50 pounds, was because of his obsessive diets and the weird routine of purging and fasting that he had practiced since he was a teenager. Because the pancreas provides the enzymes that allow the stomach to digest food and absorb nutrients, removing part of the organ makes it hard to get enough protein. The problem wasn't this major surgery. The problem was he was eating a vegan diet. That's why he lost all the weight. That's what they said. And they told him he needed to eat meat. This is a lifelong vegan. For religious reasons, for reasons of concern to the environment and animals, this man was passionate about being a vegan. Yet they told him, you're sick and you're going to get sicker, not because of the major surgery and the drugs we have you on, but because you're a vegan and you need more protein. So they insisted that he violate everything he believed to be important. So, as I mentioned, Job lost 40 pounds and eventually 50, which was due to the pancreas, the pain control drugs, the liver, I mean, good grief, you'd lose 40, 50 pounds too. Ultimately, his doctors, until his death, his doctors begged him to consume high-quality protein. Paul's wife had been a vegan when they were first married, but after her husband's operation, she began to diversify the family diet with fish and other proteins. Jobs eventually succumbed to these intense demands, ate seafood and eggs. They succeeded. The dietitians, the doctors, the friends, the relatives, the well-meaning people succeeded in getting him to violate what he believed to be most important. He was forced to turn back on his religious beliefs, his beliefs in a healthy vegan diet. The overall consensus was, and still is, that Jobs acted selfishly, stupidly, and irresponsibly by being a vegan. But he lived 30 years with pancreatic cancer. He had a tumor that doubled every 10 months as opposed to tumors that double every 3, 6, and 8 months.
And then they do a biopsy, and they're very emotional. They say, this is good. It's one of these very slow-growing 5% of pancreatic cancers that can actually be cured. But Steve Jobs doesn't get operated on right away. He tries to treat it with diet. He goes to spiritualists. He goes to various ways of doing it macrobiotically, and he doesn't get an operation.
Why doesn't he get it operated on immediately?
You know, I've asked him that. He said, I didn't want my body to be opened. I didn't want to be violated in that way. He's regretful about it. And his wife, who's a very solid, decent person, understood it, but said, no, no, the body is there to serve the spirit. You should get this operated on. And soon everybody is telling him, quit trying to treat it with all these roots and vegetables and things. Just get operated on. But he does it 9 months later.
Too late.
Well, one assumes it's too late because by the time they operate on him, they notice that it has spread to the tissues around the pancreas.
How could such a smart man do such a stupid thing?
Yeah, I think that he kind of felt that if you ignore something, if you don't want something to exist, you can have magical thinking. And it had worked for him in the past. He regretted it.
You get it? Get it? See what the video says? Did I misinterpret this? Jobs could have been cured. Excuse me? Jobs couldn't have been cured. This cancer had been going on for 24 years. He foolishly pursued diet as an answer. I don't think so. That's one of the few things that didn't hurt him, that they did to him. By delaying surgery, he killed himself? That's what he believed. That's what his wife believed, and probably still does today, unless she's read my newsletter. He was referred to his actions as stupid. How do you call one of the greatest geniuses that ever walked this earth as being stupid? Everyone else, including his wife, was described as a good person, as if he wasn't. Everybody had the right answer. Magical thinking. That was his problem, magical thinking. They created the iPhone, the iPad, my Mac, Pixar, and all of a sudden it failed him in terms of something as important as his health. And Jobs lived to regret this the remainder of his life. He did, but he shouldn't have. I think he shouldn't have. So I wrote this newsletter as a small token of thanks to Steve Jobs for all he did, to at least, tell the world that's listening, what the truth is about this situation. He didn't act stupidly or irresponsibly. He shouldn't have had regret. He should have been supported. This is not uncommon knowledge. This is not a matter of this being of anything a dispute. There's no doctor who will look at this data and come to any other conclusion. As I say, since I published this newsletter, and it got really well read, I'm sure many of you read it, and hopefully you enjoyed it. I heard an interview on NPR by Walter Isaacson, and I have to believe that I heard him say a completely different story than he said on 60 Minutes. That's what I heard. That he understood now, his biographer, that Steve Jobs' cancer started many, many years before it was diagnosed. And there was nothing that could have been done to save him. And the treatments that were done actually did tremendous harm to the man. And the guilt he had to live with is unexcusable. Thank you. All right.